Yeah, welcome to 1 Million Cups. My name is Billy, and I'm an organizer with 1 Million Cups. We also have Kyle, Courtney, Caitlin, Nicole, and John's back in the corner. All right, before we start, I was wondering if you would grab your cell phone, pull it out, and download the 1 Million Cups app. And that way, you can basically provide feedback for our presenters. You can also see who's here. What we do is we'll have two entrepreneurs come up, and they'll present their business to us in about 6 minutes apiece. And when they're done, our expert panel here will ask them some questions. When the panel's done, then you, the audience, will ask some questions also. I'm going to let the panel introduce themselves.
Hey guys, I'm Melissa Roberts. I'm here from the Enterprise Center in Johnson County, and we're a 20-year-old nonprofit organization that helps entrepreneurs find the resources that they need to grow their company through space, mentoring, education, and connections to capital. So if any of those things are things that you need, feel free to get in touch.
Hey everybody, I'm Ryan Weber. I'm with the KC Tech Council. We are an association for tech employers in the region, represent about 150 of those that fund our organization throughout the year, and I'm very excited to be here. Thank you.
Thank you. And we're going to present our first presenter. It's Orion Biosciences, and it's Joshua Sestak. Joshua?
Everyone hear me? Awesome. Hi, my name is Joshua Sestak. I'm the president and CSO of Orion Bioscience. We're actually a KU spinout. We moved up to Omaha, Nebraska in 2016. Thank you for having me here. It's always fun to do a 1 Million Cups and talk a little science with people. So Orion is an early stage biotech company. This means we're not in humans yet, but we're moving towards human. And we're focused on developing what we call our soluble antigen array technology to treat autoimmune disease. So the biggest problem in autoimmune disease is many of the therapeutics out there only treat the symptoms. So many of the things, rheumatoid arthritis, you're looking at treating inflammation in joints. Type 1 diabetes, you're trying to manage levels of insulin or treat the patient there. And so many of these autoimmune diseases, a lot of these drugs look to treat the symptoms, but do nothing to actually reverse the disease themselves. And so that's what we're looking at doing is as an early intervention, so finding patients that are recently diagnosed with these diseases and actually bring them back to what's called tolerance, so bring them back to being healthy individuals. So all my degrees are in chemistry. My focus is in immunology. So when I think about autoimmune diseases, this is what I see. This is what my brain looks like. Lots of immune cells, B cells, T cells, cytokines, all these different things. And I could sit here and talk about that, and then half the room would be asleep in about 3 minutes, because no one really cares about the science. Not in a bad way, but it's just really complex and it's really hard. So I go and I talk to my chief business officer, and this is what he sees in his head. It's numbers, it's dollar signs, it's patients, it's the amount of drugs that are on the market. And these are the top 8 approved therapeutic areas in autoimmune disease. And I want to stress approved because many of these diseases themselves are treated with what's called off-label. So they don't have an approved therapeutic specifically for neuromyelitis optica, or specifically for Graves' disease, or specifically for myasthenia gravis. So rheumatoid arthritis, multiple sclerosis, in 2010 it was a $47 billion market. Estimates for 2017 was over $70 billion for approved therapeutics. But the reality of autoimmune disease is this. Over 6 in 10 patients are female. Most of these females are young or childbearing ages. So these are sisters or mothers with young children. And many of these autoimmune diseases take away from their way of life. So it takes away their ability to see, takes away their ability to walk, takes away their ability to interact with their children. So it's a huge impact that they have. And you can imagine that if these patients are only being treated for their symptoms and not the disease itself, how frustrating that can be. Because really what they want to do is go on bike rides with their kids. So at Orion, as I said, what we're looking at doing is asking the question, can we treat these patients earlier? And can we actually reverse their disease? So the biggest thing with this is we've gotten really good at detecting diseases in individuals, whether it's a genetic predisposition, whether it's environmental conditions that are leading to it, whether you're showing early signs of a disease like multiple sclerosis, but we're really bad at treating those diseases early. We wait until the patients are way on this side of the spectrum in the disease state and they've had it for 10 or 15 years, rather than saying, look, we know you have markers of the disease. We know that you're developing the disease. Why can't we treat you there? And so that's really what we're focused on. And then our therapeutic here, this little kind of fun cartoon, soluble antigen arrays. This is how we're going about doing it. It's an area called antigen-specific immunotherapy. People have tried a lot of different approaches, some more successful than others. And we have about 10 years of data and a bunch of publications and, of course, patents around this. Trying to advance to the clinic in type 1 diabetes and neuromyelitis optica in the next 2.5 years. So with that, I mean, every great company needs a great team. We have over 85 years of experience in biotech, most of it in Silicon Valley, both domestically as well as internationally, private, public biotech. You know, you hear the same story with a lot of these entrepreneurs. But the biggest thing about entrepreneurship, and I've been kind of at a 1 million cups before, is sort of sharing some of your perspectives. I'd love to talk more science with any of you guys later, and you can ask me any questions. But I kind of tried this out at Lawrence 1 Million Cups. This is my entrepreneurship in the laundry theory. So everyone out there as an entrepreneur runs into experts. And the biggest thing that we find is even the best VCs that have had the most success over decades are wrong 80% of the time. So when someone comes up and tells you that your idea is wrong, or that you're not doing the right thing, take solace in the fact that the best people out there have been wrong 80% of the time. So this is my family. I have 4 kids, ranging from 2.5 months now to 11. And so you can imagine we have a lot of laundry. Now this is somewhat amplified, you know, I gotta build it up for this. But this is kind of like what you walk into every day as an entrepreneur. Whether it's daily, whether you went on vacation, whether it's just been an afternoon. You walk in, you have this giant pile of mess, and what are you supposed to do? And so in my entrepreneurship and laundry theory, the biggest thing is, find the towels. Find those big things that you can fold up, get out of the way, put to the side. And because that drastically does the pile. My wife is an accountant, and she says she wants to be an accountant because you always have a job and you always have stability. But the problem with accountant is there's a lot of stuff to do. And so if you can find those towels, it makes finding the other things, whether it's jeans for kids and all this stuff. And you go through, and what happens is you are left with this pile of socks and little tiny, pants and little tiny underwear. But this is where most people get mixed up. And I tell my kids and I tell my friends, I say, don't get lost in the socks and underwear, because most of the kids nowadays don't care if their socks match anyway. But if you sit here and you're trying to find all those socks in this big mess, it doesn't matter. And the biggest thing is then to delegate. We're a virtual biotech. We have 5 people. Some people have 2 people. And I can't tell you don't spend time on email, because I spend most of my time on email on the phone. But you can find those emails that are kind of the big laundry items and then move forward and then delegate, whether this is delegating to someone else or delegating till tomorrow. And so that's kind of my fun entrepreneurship and laundry theory. Go back to the Orion slide, and really what we're trying to do as far as changing the face of biotech and how we treat autoimmune disease in patients. So that might have been 6 minutes? Sweet. So with that, I'd love to talk more to you guys about really what you want to hear, what you want to know, and go from there.
Thank you, sir. We will kick it off with our expert panelists.
Hey, so I think you're right in that in a highly technical world, it's probably best to concentrate on the larger themes of entrepreneurship. So I really enjoyed that, the laundry theory. Can you talk a little bit, because one of your slides had a bunch of different kind of segmented pieces of your market, and I noticed that some of them were much larger, but some of them had a much higher kind of growth potential, like the lupus market has a really high CAGR. How did you choose where to concentrate first?
From our perspective, it was really focused on the science. So, you could take a market like rheumatoid arthritis or multiple sclerosis, and there's, a ton of companies out there that have a ton of therapeutics ranging from oral to injectable, so a pill versus getting a shot. And so from the market strategy standpoint, you say that market is just completely taken. It's going to be impossible for us to get into, so we don't want to be there. So where is the best fit scientifically for where we're at? Where is a disease that has a high need? So these could be patients that, so neuromyelitis optica is one disease we're going after. This can be very aggressive. Your first attack, you could become blind for life. You could have an attack where you're blind and then it comes back. So the response to the disease is very severe. So you have a huge need there for a therapeutic. Or it's a very underserved market where there's no drugs in that market itself. And then how does that fit in with the science? So we have a pretty good understanding of how soluble antigen arrays work. And so looking at diseases that operate by that mechanism. So while autoimmune disease all kind of have similar progression in a general immune sense, some are more driven by T cells, some are more driven by B cells, some have other kind of factors that go to it. So we chose that, kind of based on both market potential and science to go after where we're at. Because all the markets are, in pharmaceuticals, they're all billion-dollar markets, is what people want to say.
I made the huge mistake of watching that Dirty Money episode last night about Valiant Pharmaceuticals. Has anyone seen it? I lost so much faith in our life science and pharmaceutical world. But I think the key question after you see something like that and you see, that pharma is huge in America, and it's also still huge with opportunity, and there's a ton of money to be made. But I think for the startups and the entrepreneurs and people who are medical experts like you, to make it, it's still really hard. Would you mind sharing some of that? What are some of the inflection points that pharmaceutical companies or life science companies like yours have to meet just to be successful?
Yeah, pharmaceuticals is interesting, and I think it's at a turning point because we've gotten really good at managing symptoms. We've been really bad at managing disease, and so I think there's a lot of push not only from the general public, but also from companies to shift to managing disease. We've gotten really good at that in cancer. But the biggest thing, and it's not a problem, but the biggest thing is the cost associated with it. And the cost is directly related to the requirements to get into people. And because we've gotten really good with managing diseases and their symptoms and their progression, and we're really pretty good at managing the safety associated with those drugs. I mean, I'll throw all the cancer stuff out the window, because the goal in cancer right now is to kill the cancer before you kill the patient. But safety is huge, right? So the safety hurdles are really, really high, and to meet those safety hurdles takes a lot of testing, which takes a lot of money, and then you have to get that money back somehow. And so as a small biotech, that's the biggest hurdle, is making sure that you can finance this adventure from the lab all the way to the clinic. And you can do that in a lot of different ways. We've just been scrappy. So we've raised as little money as we possibly can. We've leveraged a lot of relationships, so we're very relationship driven. You see, I have a large family. My philosophy is families first. And so there's times where I'm just like, you know what, my family comes first. I'm not going to do this right now, which has helped us because we can develop those personal relationships and we get people to work for very cheap. But to move kind of what's called the valley of death, you have to be innovative, because you can't just, I worked for a company in Seattle, and I left that to go to grad school, and then a couple people started a company out of that. They went public 15 months ago. They're bankrupt. So, I mean, you can raise $25 million, and it doesn't mean you're going to be successful. So it's not just the money part, but making sure you're taking into account all those different factors and understanding it's complex. And trust me, Big Pharma knows it's complex too. And so they're positioning to say, look, these are different approaches because status quo is no longer acceptable. So, I mean, the big money things are, kind of meant to be scary. I mean, it's just like the nightly news, right? We never hear about puppies and rainbows. We always hear about the bad stuff.
I think the other thing too is important, just how long it takes for life science companies to be successful. Now, you seem like a young guy, so maybe you're like, it happens. But would you mind sharing some of that? I mean, it takes a significant amount of time versus like a tech company. You and I can spin up a tech company and maybe have success this year. That's not possible in your field, is it?
No, I wish it was. I was just sitting, one of our early investors, And one of my advisors, so Mike Beckloff, he started Beckloff and Associates. He was one of the first investors in Orion. He's been a mentor to me. We were having lunch, and I have a lot of colleagues across fields. They say the one thing that really I wish I could do in biotech is the straight hustle, right? You have all these companies that all it is if you can just straight hustle out there, out hustle the guy, outsell the guy, outdo that, you can just rocket sled on rails, right? Biotech, it's not that way. As I said, this science is 10 years old. We're still 2 years from dosing our first human, 3 years. And that means we're still like 7 years possibly from actually having a marketable therapeutic. But that being said, as you go along these curves, we could start a tech company tomorrow. Maybe we sell it for $50 million. Maybe we sell it for $100 million. But the curves start to diverge later on if you can just get through that. But that also being said, you fail a lot along the way, and so you have a lot of good experiences and stories that you can share with other people across the spectrum, whether it's biotech or tech or.
My last question. So I was at an event last week with a bunch of civic business leaders talking that the Kansas City region is this life science hub. What are your thoughts on that? You're in the middle of that. I mean, is this the place to start a biotech life science company?
We're sitting in a building that was funded by life science. So yes, it's possible. We have lots of good resources here. We have some energy here. I think we can do better. I think we can learn some lessons, but it's expensive to do it on the coast, right? And so there's that, what is that energy factor that drive that there? So as I said, we're sitting this whole thing was started by life science. Granted, you and Kaufman got to grind up oyster shells in his basement and sell it out of the back of a Cadillac. I can't do that anymore, but it definitely is possible.
So, Josh, one last question kind of from this group. You mentioned in your remarks earlier that you don't kind of take raising money as the sole mark of success, and that the journey's a lot longer than that, and it's just one data point. Can you talk maybe about the milestones that you're most proud of achieving so far?
Just being alive. As a company, personally, I like being alive too. As a biotech, it's tough. You get a lot of knocks. The science world, they're not nice people. The biggest thing in science is finding those what we call kill experiments. And so as a good scientist, you are always looking for the kill experiments for your own stuff. And so as critics and as advisors and stuff, you're looking, how can we kill this, right? And so you're always looking at how can you kill this as quick as possible, because it's going to cost a lot of money, because it's going to take a lot of time. And so that's why I say they're not nice people, is because they're always sitting there and you're always very, negative is the wrong word, but you're not looking for how can we grow this, how can we make this bigger, how can we do this? We're like, how can we kill this as fast as possible? Whether you're in the research stage, whether you're in phase 1 clinical trials, whether you're in phase 3 clinical trials, we want to know if this is going to fail, how can we make this fail right now? And so the biggest thing is really not only having success that way, but having opportunities to talk in areas like this. I'll be going out to DC for the 3rd year in a row to help lobby for bioscience and lobby for other stuff. And so being invited to those things, even though Orion, we're still 5 people. We haven't raised $25 million. We haven't been out there, making headlines on all these different things. But being recognized and invited to these different things, I like it. And being able to give back then, being sought out by people that say, hey, I'm thinking of doing this. My first advice, say don't. And then if they don't run away, then I say, okay, then let's talk. But that's really what I enjoy, is that kind of being able to kind of give back through my fairly young, Orion, this is going on our 6th year. And so, as I said, there's a lot of good stuff that goes along with that, because as a scientist, the science is going well, and that gives, that's kind of what I like. But growing as kind of other outside of a science person, when I graduated with my PhD in 2011, I was the expert in drug delivery and immunology for soluble antigen-specific immunotherapy, right? Because I just wrote my dissertation on it. I just spent 4 years. I'm no longer the expert, right? Because I don't have that amount of time, but I can still get to share my experiences, that's what I really enjoy.
We're going to turn it over to you for questions. Please get those hands up, and we will start right here on your right.
I'm very excited about your presentation. I have watched my mom for the past 30 years try to figure out what's going on with her body. She's essentially a walking autoimmune disease. So it's really cool to see someone taking that seriously. I don't know how many dozens of photographers, sorry, I'm a photographer, dozens of doctors and hospitals and tests, and she still doesn't know really what's wrong with her. So I know you're mainly attacking people who trying to figure out what we can do before it gets to that point. What would your advice be for people who are at that point, who have been searching for 30 years, trying to get an answer? What is the goal for them?
You know, I'm not a medical doctor, but you know, one of the things that we talk about, and you know, the reason we're, as I said, we're going after these patients is because we understand this part of the disease a lot better. But the goal is to push those trials and say, how much further can we get to here that you can still bring it back this way? You know, and then I was given a presentation out in New York City, you know, and there's a lot of other factors that go into this, whether it's diet, exercise, you know, where you live, you know, and you know, there's a lot of other resources that go along that. One of my colleagues, his mom was diagnosed with MS, and she had the disease for 15 years and no one knew it, right? And so it's hard, and autoimmune diseases, it's really complex because it's your body attacking your body using the body's own mechanisms, right? So it's not like you get a cold and we're like, oh, if we kill the cold, the disease is gone. So, you know, reaching out to patient advocacy networks. So we have a relationship with both JDRF for our type 1 diabetes program. We have a relationship with the Guthrie-Jackson Foundation for NMO. We have a relationship with the MS Society for MS. And so those patient advocacy groups not only help patients, but by having information on patients, where they're at, what stage of disease, what they've been on, the drugs that they've had, the drugs that failed, the drugs that work. When you put together clinical trials as a biotech, you can use that information to start recruiting patients. Say, all right, here's the first set of patients that we think will have the most success in. You know, here's some refractory patients maybe we want to include. And so developing those relationships with the advocacy groups, you know, finding networks of people that share similar stuff, it actually does pay off on the development side of things too, because as I said, it's a great resource. Not only do they provide grants to companies, but they provide a lot of information that people can either data mine from or other stuff to develop therapies.
Can you give us an example of a drug that's already on the marketplace that's in this pre-disease section? Because right now, all I can imagine is this joke that was in a book my grandma had that's like, take your pill bottles, spill them on the floor, pick them up one at a time.
None. I mean, pre-disease, there's a lot trying to go after it. You know, we've gotten really good at diagnosing disease. There's a lot of diagnosis there. But trying, you know, you have to, it's a big case, right? Clinically, these patients aren't sick. They have markers of disease. They're heading towards disease. They're going to develop disease. Like in type 1 diabetes, if your brother or sister has it, you're at risk. So they start following you and you'll start presenting with markers of disease, but you don't have type 1 diabetes by current clinical standards. And so you have to wait until you get there. So I mean, that's one of the big, you know, I was at a conference in California a couple weeks ago, and that was one of the big things we're talking about, is as you define clinical success criteria, as you move earlier in these patients, you know, you can't use the same clinical success criteria that you use over here, because those patients are sick. They've been sick for 5, 10, 15 years. So it's a new field, and that's where I said to him, it's interesting because, you know, big companies are recognizing that problem is there too, and that you need, if we're going to start treating disease rather than treating symptoms, so it's fun from a scientific standpoint.
In the front.
I come every week looking for what I can learn from the presenter. This is a rich environment to learn about early stage entrepreneurism. And what I'm curious about with you, if you've said it and I missed it, I apologize, is you are clearly a subject matter expert in this space. How did you make the transition from being someone who was highly educated, had a lot to offer, into being a part of a startup team? Can you give us, because many of us are interested in how we can take our expertise and turn that into part of a startup. So what were maybe 1 or 2 lessons we can learn from you?
So I worked for a small pharmaceutical company in Seattle, and then realized I needed to go back to grad school. And so when I went back to grad school, my goal was to graduate in under 4 years and go get a job at a big firm, leave as fast as I can. And I came here, I was a self-graduate fellow at the University of Kansas, and then I was also a dual self and Institute for Advancing Medical Innovation fellow. And so during those fellowships, I got introduced to the Kauffman Foundation and some of the entrepreneurship stuff that was around here. And it's really interesting, right? Being able to take something and bring it into an environment from kind of where I came. And I spent a year after I graduated really looking into that. So really trying to learn business as fast as I could, right? Took an entrepreneurship class at University of Kansas, attended a couple different workshops, and really just talked with lots of lawyers and lots of business people and try and find a team and say like, hey, if we try and put this business together, what's it gonna look like? What do we need to do? Because there's a lot more that goes into a company than just the science, right? 90% of my time is related to business now, whether it's fundraising or books. And so then it really was a thing where we said, well, if we're gonna do this, we're gonna do it now. We wrote an SBIR. We were lucky enough to get the SBIR. And so that was we said, well, we have money now and we have things that we told the NIH that we're gonna do, so we better start doing it. So I don't know if there's like a defining point in that.
I think one of the encouraging things we can all pull from is how long did that take from the point that you said, you know what, there may be an entrepreneurial future for me here, to the point that you got there? That was a lot of time. How many years was that?
Yeah, I think the first presentation that I did with Orion on the slide was a year before I graduated.
Okay.
So it was probably about 2.5 years before we started the company.
I think that's something we can all learn from is it takes time, process. Thank you.
Question up front.
Hi, so I have some questions about Orion. What is it about your company that makes you likely to be successful? In other words, I'm assuming even though you, when you graduated, were maybe the only expert on this soluble antigen array business, that first to market may have been in the back of your mind, but you have multiple billion-dollar companies that are potentially able to leverage this thing faster and better than maybe you can. So is there anything unique or proprietary about what you're doing that is going to lead to a successful business here?
Yeah, definitely proprietary. That's the lifeblood of biotech, right? You better patent your stuff or you're going to be squashed like the bug that you are, to quote Shark Tank. On the other side of things, actually big biotech enables us in the sense that they got rid of their R&D departments a decade ago, and they fill those pipelines through partnerships and acquisitions. So they either partner with young biotech, so they bring it in. Celgene actually just announced they've been kind of reorganizing their company into oncology and then autoimmune disease, and they just announced a third kind of focus that they are going to populate solely through partnerships and acquisitions. They're going to have no internal R&D. And so they're just going to go out, find companies, pluck them up, bring them into their pipeline, whether it's through partnership or acquisition. So that is actually helpful, and we have conversations with these big companies now, and we say, okay, working towards this, what are the key kind of success criteria that you want to see, whether it's preclinically, early stage clinical trials, or in just a general development. So from that's good. And then from the science side, by taking a different approach, you need to be very confident that your different approach is successful. And so we've spent a lot of time looking into what we call mechanism of action. So how does this work compared to other things that are being developed within the same space? And so many times, as I said, you run those kill experiments. You just run stuff head to head, right? And so you say, if you're better than this, what better way to test it is just run the two things and see if you're better or not. Or see, if you look similar, how are you different, if different at all? Because if you're not different at all and they're already in people, yeah, you're probably going to run into some problems. So kind of balancing, patents and stuff, I'll say monthly, but it's probably sooner than that. We always have conversations about patents. We talk with our patent lawyers and we talk with our counsel. From the pharma side, we have partnerships and we have collaborations, and you build those from the very beginning, because if you don't just walk into Merck or Pfizer and say, hey, I got a great idea for you guys, you want to buy it? No, you start that relationship and you build it. So it's about these relationships that we've had for 5 or 6 years. And then from the science side of things, you got to make sure, because everyone's going to try and poke holes in it, that it's as sound as you can make it. So because of those things, that's why we feel we'll have success.
Josh, final question. What can we as a community do to help you?
I think, kind of pointing to what you said, and you'll see these things of Kansas City as a biotech hub. I sit on a lot of STEM panels, and I do a lot of things that are focused on science and just getting people excited about science. I know building apps and computer stuff is it's cool. I don't understand it. I scream at my computer when it does stuff I don't like. I'm like, why are you doing this? But getting people not only excited about science, but trying to enable. I'll sit in things and they say, well, how can I get into a lab? I say, walk into a lab and say, hey, I want to work here, because we need people there. And so trying to help those that say, hey, I want to get into a lab, whether it's finding a ride to a lab or anything like that. And so I think, as much as tech and computers, we have code, you have the coding weekends or coding days and all these other computer-focused things. Say, hey, we should do something like that. Support the Kansas City Science Fair. Support, some of these other efforts that are encouraging kids to get into science as well as technology, engineering, math, and arts.
Awesome. Thank you so much. Alrighty, let's do Mug Club real quick. Can you please raise your hand if you have been to 1 Million Cups 10 or more times? Put your hand down if you already have a mug. I see a couple. Billy's gonna run a mug out.
Tell us your name and why you come to 1 Million Cups.
Hello, my name is Zephyr Johnson. Thank you for the mug. I come to 1 Million Cups to just get some ideas about my personal business. I have a tax business and an insurance business.
All right, thanks for joining us. Let's have a warm welcome for our next presenter, Michael with TV Wiz.
Well, hello, everyone. First of all, thank you to 1 Million Cups for having me here today. So, I'm the founder of WizBiz LLC. We're a very new company here in Missouri. The reason why we were here, as you can hear from my English accent, the reason why we are in Kansas City right now is my wife came to work for Sprint, and after about 2 years of me playing golf, she said that I need to go out and start finding a real job. I did not want a real job, so I decided to go back on what I'd done previously. So WizBiz is the company. TV Wiz is our first deployment of our price comparison algorithm. We also plan to use fiber, cellular, Insure credit as other range products in the brand. The actual market for insurance and utilities in those are actually the high revenue markets. The reason why we've started with TV is that there's a need right now. There's a movement, a cord-cutting movement. So it was the low-hanging fruit that we could go after. So a little bit about myself. So I've previously worked for tech startups. Voucher Cloud Europe was a successful exit. I also worked with Best Buy to create Best Buy Mobile. And one of the other things is I created an early version of a mobile phone price comparison engine that we sold to Calphone Warehouse in the UK in sort of 2004, long before the boom in price comparison in Europe took hold. My wife's also part of the team, but she's more of a helper to make sure that all my numbers stack up. She's a CFO of a FTSE 100 business. We also have Franco on board for brand, and he's ex-Amazon and Saatchi Group. So basically, what's the problem right now that's happening with TV? Well, at the moment, the cost of cable has outpaced inflation over the last decade, or 20 years, I should say. So in 1995, the average cable bill was $26. In 2016, that's risen to $103. Customers often fear switching companies because they get so used to their Walking Dead or their programming that they go, well, if I leave, I might lose the following programs. And also, there's no easy way for them to go, okay, which are the channels I actually watch versus the ones that I've never, ever been onto. So a little bit about the market. So 2 million people switched from a cable service in 2016, and there are an estimated 25 million people now who do not have a paid TV subscription. New cable alternatives launch every year. So there was about 5 or 6 launched last year, and there's about 5 or 6 more ready to launch this year. Also, millennials. When you hear things like millennials are ruining cable or ruining baseball, I've heard the people say, it's because they reject historical billing practices and historical ways of doing things. So they don't want to have 300 channels and pay for 300 channels and watch 5. They want to zero in on just what they want to pay for. So what we need is a solution that will able to recommend TV plans. We want to directly compare cable, satellite, and streaming. And we want to be able to sign up directly from the product. The idea is that we can save people money, we can save time, and we can remove that fear. Fear is a very big emotional factor in any kind of decision-making process. So the product, we want you to be a TV Whiz in 3 easy steps. Now, I must stress, this is live. You can go on your phones to tvwiz.com and actually play with this yourself. In essence, all you have to do is pick the channels that you know you actually watch. It will then tell you, well, this is the cheapest way you can get the service. You can then delve deeper into a particular service and then sign up. So here's a little video. So when adding channels, what we've done is we've picked the 50 most popular channels and added them automatically, and then the rest of the channels are added behind a search. Once you've picked all your channels, you're able to build the results and by selecting the Show Me My Results. Now, it's very important that we have streaming, cable, and satellite prices side by side. Streaming is not without compromise, and some people do not want those compromises. So what TV Whiz does is it allows you to say, well, the cheapest package here with all of the channels you wanted was Dish. However, we found one with one of your channels missing, and you were able to save money. Premium channels are highlighted as an extra item. And then you can sign up straight from it. In terms of competition, so right now in the US, the price comparison market is actually in a very early stage compared to other markets globally. A lot of the competition basically don't do any kind of recommendation and don't do any kind of personalized recommendation. So 2 examples that I put up there with the little video, all they do is just pick the 3 that pay the highest commission and say, here, pick from one of these 3. NerdWallet, if you've heard of NerdWallet, are a company that does it properly. Now, they've raised $110 million, but they at least try to find factors that a customer can use to say, hey, this is how I want to buy this type of product. So NerdWallet are a good example of someone that's doing it properly. What we have right now is we are a first mover that's doing this a bit like internet shopping before Amazon. It was just a case of, well, here's everything I've got, pick what you like. Whereas Amazon tried to delve a little deeper into what you specifically are interested in shopping for. We want to be a one-stop shop. At the moment, the content is very fragmented. The impartiality of the recommendation is very important. So even now, we've had Sony PlayStation Vue come to us and say, how do we get PlayStation Vue #1 in the list every time? Can we pay you for this? And we said, no, actually, the only way you can do that is if your price is the cheapest for the consumer to buy. And we're looking beyond just TV. We want WizBiz to be a place where you can completely price comparison your life. So very quickly about the business model and how it works. So at the moment, it's in an affiliate marketing model, which is every time somebody signs up, we get between $20 and $150. There is an advertising and sponsorship component because, as Sony have said, how do we get to the top? Well, we're not going to skew the organic results, but what we will do is maybe have a feature spot or a sponsorship spot to say, TV Whiz recommends because. Assisted sales license. So when we did this in the UK, as I pointed out with the mobile phones, what it was originally designed for was for sales customers to be able to find the right mobile plan without having to speak to a sales consultant. And what turned out to be the case was the sales consultants were just using the touch screens to actually do the sale with the customer. So we've been speaking to different companies now so that if you are buying Dish from a mall, rather than go through bits of paper, rather than have a very uneducated, not uneducated is the wrong word, untrained team that are so fragmented across a lot of malls, a company can actually control the brand aspect. And then the big data part is very important at the end, because as more companies launch, every single price plan is getting cheaper and cheaper and cheaper. So that means the margins are getting squashed. So if you have a company which has chiller in the marketplace and nobody is asking for that TV channel, they can either lose that channel with no effect to their customers and put 50 cents back onto their bottom line, or they can repurpose that 50 cents to say, okay, is there a channel that is better suited to our type of customer lineup? And we'll be able to provide that data. So one of the questions that 1 Million Cups wanted us to answer in our 6 minutes was, how can the community help us, and where are we with the problems that we have with the business? Well, we've been able to attract users to the site at around about 12 cents to 15 cents, 20 cents sometimes, and we're picking up on a lot of negative sentiment and then presenting our product. What we're finding is that the marketing scale required for a country the size of America with 120 million homes is a little bit unachievable using my credit card. So payment terms are also a big problem. So a lot of these companies, Sony in particular, to re-harp on them, you know, they say the customer has to be a customer for 3 months. Once they've been a customer for 3 months, we will then pay you in 120 days. So actually, a lot of the revenue that you potentially are seeing won't happen for 9 months' time. Other elements of the business model have longer contractual leads. So again, using that same example, it's taken me 9 months to get Sony to just do an affiliate contract with me, which is just a case of, if I send you a customer, you'll pay me. It might take me another 12 months to actually get them to sign up for the tablet sales system. Also, there's another piece. Because this doesn't really exist here and it's very established in other markets, there is an education piece which has to be done with the customer. Because I get a lot of questions from people saying, how much are your channels? Do you get ESPN? And when you explain to them, say, well, I'm just recommending a service. I don't have my own channels themselves. They go, yeah, but do you have Fox Sports? No, but I can tell you who has Fox Sports. So there is an education piece, and that trust brand takes time with sustained marketing activity. Thank you for listening.
We'll start out with our expert panel. How to work the mic. Okay, got it. First question. Talk about your process for customer validation and how that's led to traction so far, where you are in that process.
So right now, in terms of customer validation, what we have been finding is that there are different types of people that go on an information search, and then there are people that are making the actual purchase decision. And so, for example, what we see from a lot of the data is that, and even some of the Facebook tags are a great example, where you will get the lady of the household tag their husband and says, this is the sort of thing that you need to help for. So we're finding that the traffic onto the site is almost 90% male. What we're finding is right now is that a lot of the customer data that's coming back in are from people that are absolutely hating cable, and they just want to go for the opposite end of the spectrum and go for streaming. As I pointed out, we're kind of more of a broad brush, but right now, because of the almost the distrust and dislike of cable, you're getting the other polar opposite rather than a broader spectrum. So at the moment, it's a largely male-orientated product, and whenever we do the Facebook, you'll find that the volume of male to female is extremely high, and the millennials are just off the charts. Anyone between 22 and 35 is the absolute sweet spot.
So do the streaming companies offer the same referral rates as the traditional cable providers?
No, they do not. So the traditional cable companies offer about $150 a bounty, whereas some like DirecTV offer $40, $50. Some like Sling only offer $20. So it's a spread, and it really depends on how aggressively they are trying to be in the marketplace right now. So Sony, for example, have just come on board at 100, which kind of puts them in the middle of DirecTV versus like a Dish or a Uverse. What tends to happen is In the growth acquisition stage, what they're chasing is just subscribers. They don't care if it's 5 million in the front door and 4.7 million out the back door. They just want to say to someone, we've acquired this many number of customers. Now that will change in the future. One of the advantages with the business model with streaming is that it's a month-to-month contract. So right now, if somebody signs up for DirecTV, we get a bounty. If in 3 months' time they go, well, they're no longer the cheapest, it's now PlayStation, we get a bounty. If they switch again in 2 months' time, then we get a bounty. So we're able to monetize the same customer multiple times as long as there are companies chasing the dollar.
And then the last question I had was, so I used it last night
Yep.
because when I do this, I try and see the company and use it if I can. I noticed you didn't ask for my address. So can you talk a little bit about kind of how you match the right providers?
Yep.
I'm not trying to do a gotcha, but I just noticed that
No, I understand, yeah.
the
So
cheapest option wasn't available at my house.
So one of the aspects is YouTube TV is a good example. So it is largely available over the top. So what we've done is we've tried to pick companies that we can almost guarantee are 95% US penetration. So we've removed lots of the tiny little smaller cable companies because once you start driving into that level of detail, it becomes almost impossible to get a product live. And that's one of the other things that I would stress to someone is that when I've worked in other tech startups, they go, we don't want to launch until it's 100% ready. The problem is that you can run out of money before that happens. So what we decided was to get this out into marketplace, that having those little niche companies would just remove them. So DirecTV and Uverse are a good example. Most of those are available in most homes. With things like YouTube, where there are 1 or 2 cities that are not available, we actually put in the description, please check your city, because it may be that this particular provider is not available. So the ones that you see in there now should be largely available in the most amount of homes. If you live in an absolute rural community, then you're probably not my target demographic anyway, but also receiving a TV service is very specific to your region.
Real quick, you mentioned some of the demographic data that
Yep.
you're able to collect. So what other data points is this service collecting, and how valuable is that?
So as I pointed out earlier on that big data piece is that right now you've got a cable situation where the average price of cable is $116. You have Hulu in the market at $40 for their live TV. You have Philo in the market at $16 for their cheapest package. So suddenly when you have all of these streaming companies come in at a sort of $16 to $35 price point, they are all need to make sure that every single channel in their lineup is squeezing the dollar for them. And so that's where the data comes into play, because either, as I said with Chiller as my example, if nobody wants that channel and it's in your lineup, you still have to pay 50 cents every month, every subscriber to have it in your lineup. Now, you could choose that because it's a low margin business all of a sudden to put that straight to your bottom line. However, what you could do is to say, okay, TVWiz, of all of our customer profiles, is there a channel that people are asking for that we do not provide because we have 50 cents per user left over? And then that data would be able to say, well, actually, if you pick this channel, it still keeps you under the 50-cent mark, but it will greatly increase the appeal of your price plans. And you only have to look at ESPN. ESPN adds per user per month to your bot price about $10 a month straight away, just having one channel.
If we were looking to the crystal ball of the future, at what point are we ever going to be able to choose a la carte exactly what content we want to consume?
This is more of a personal thing rather than I would say you probably won't get there. The reason being is that you would lose so many millions of channels, right? Which is not necessarily a huge problem, but actually, in reality, some of the channels are subsidizing other. Some of the channels that you pay for are subsidizing other businesses. And I think what you will do is Philo is that great example. So what Philo done, if you don't know who they are, is they've said sports channels are the most expensive channels you can physically have because they're bidding for licenses for the baseball and all these things, and they have to recoup those margins. So what Philo have said is okay, let's get rid of all sports, There are people out there that do not want sports. This is where we're going to fit in this crowded market space. And they've picked channels that are high entertainment. And they said, okay, this is our lineup, and we're going to be in at a $16 price point. I don't think you'll ever get to a situation where you can just say, I'll pay ESPN directly for $10. I'll have that channel, that channel. I just don't think the networks will allow it.
And real quick, you mentioned some of your competition. I think that's really important. What's stopping your competition from doing exactly what you're doing?
So right now, there is none. So not every business has, like the biosciences, has a cast iron wall to prevent people being here. What I would say is that if you look, coming from a different marketplace where, £1 billion of TV advertising was spent last year on price comparison in the UK, Germany, France never have equal businesses. So each country has about 10 players just in that same space. Some of them they have 10 players just in utilities. The US can easily cope with 10 companies. And actually right now, I need someone to come with me in that. And so actually a competitor joining the market would be good for me right now because it's the enemy of your enemy is your friend. So if I'm trying to educate consumers, before you buy a product, go here. If there are 2 people shouting that from the cliff tops or 3 people shouting it from the cliff tops, it would actually help my cause. And you find that, so I'll give you an example of how that works. So again, I apologize for making it about the UK, but 77% of all insurance policies in the UK went through a price comparison website, because users go, why am I going to go on 10 companies' websites to get a price? I just want to go on one price, list them all in rank order, and then I will pick which one I want. And so you need that competition in the marketplace to get consumers to that point where they go, I am not going to go on 10 or 20 different websites. I just want to do one.
Do you have any idea, and I don't want to hold you to this, I think to get to the point where 77% of all inquiries for this service is going through your site, how much money, time, advertising, viral would be great, but do you have any concept of what that would take for you to be 77% of the market?
So I think the
Well, actually, sorry, I have a second half of that. I really want to ask too. What's the revenue potential at the same time if you get that kind of penetration?
Okay, so answering the first question, I think it'd be extremely arrogant to achieve that 77% of an entire population would go through my company. I'd love to get there, but what I was saying is of the 10 companies in the UK, 77% of the traffic goes through those 10. Same with France and Germany. So I think that's ultimately where we need to get to. And if you looked in a time scale, that kind of happened over a 15-year period. Okay, to achieve it now, without any competition, then let's just look at NerdWallet. So they've raised $110 million. Okay, so that's how much they're raised to get where they are. So they have a product live. They are generating revenue, but it's taken $110 million. So the advantage we do have is that we haven't spent $110 million to get a product live. So that's one key aspect. And what was your question? The revenue opportunity. So back to if I click back to the first slide very quickly, go backwards. Because I'm going to answer this question by explaining, again, how I decided to go to live with a product. So for me, insurance and utilities are the big money market items. This is where you can earn bounties of $300, $400 per area. Credit, again, is a very important one, and you could have said cellular. Well, that's your background. You've worked in a lot of mobile phone companies. You know the industry. You've built one before. But actually, we decided to go for TVWiz because it is actually the lowest revenue opportunity right now, but it's the lowest barrier of entry to get the product live, get the algorithm working, get it tested, cut through all the different problems. And a great example would be, as you do, I was in Branson, Missouri for Labor Day. We did all of our load testing. We put it live. I was anticipating 20,000 users in the first week, and we had 20,000 users in the first hour, right? And so suddenly everything caught fire because we did not have anywhere near that capacity for load. So revenue opportunity for the whole thing, if you can get 4 or 5 services out, you're looking at about in 5 years at about 50 million. Right now, just from TV, it's a 1.5, maybe 2 million business.
All right, thank you, experts. We're going to turn it over to you for questions. Please get those hands up. I'll get us started. Diving into the weeds with their last set of questions, what does your marketing strategy look like? Are we talking social media, advertising, where are you headed?
Yeah, so to be very honest, social media is what works for us. So my background is obviously working in marketing for people like Best Buy and for tech startups like Power Technologies and Voucher Cloud. Things like AdWords and stuff like that, I found that very hard for me to present a return on investment from my marketing activity. And the reason being is I assumed before we put any tests live that I'd be bidding against people like Hulu or YouTube or PlayStation or DirecTV, but actually who you're bidding against is Best Buy. And Best Buy are not interested in selling you a TV service. What they're interested in selling you is a little Roku dongle. And so it becomes very cost ineffective for me to get that kind of cut through. What I found with the social media activity and through social influencers are that I can pick up on negative sentiment. So if somebody's saying, I'm paying too much for my cable, and you've got expensive cable and you're picking up on that negative sentiment, that's how I'm able to very, very quickly zone in on somebody that would be interested in my type of product.
Question in the back.
Great presentation. Does the TV with service take into account like bundling options for the bigger, like AT&T, DirecTV, who will offer a discount on their TV services if you buy their internet or phone plan or something like that?
That's ultimately what we want to try and do with, once we get to the fiber and cellular whiz. A lot of millennial homes will lose their fixed line telephone and just rely heavily on cellular. So right now, this is a pure TV play, and the idea is at some point, if you have fiber and cellular in there, you can unbundle your home. What it does take into consideration is right now is that, let's say, for example, the ideal package that you wanted to go on was, and I'm just going to make it up for argument's sake, $40, but you wanted HBO, so that pushes it up to $55. But DirecTV do an offer where DirecTV Now, the streaming provider, has an offer where HBO is only $5, but their plan is $45. Well, if you add the 5 on, that means you're actually net $5 up on the equation. So what TV Wiz, the algorithm will do is say, okay, total cost of ownership, the cheapest way for you to own it would actually be to go for this company's price plan because you're going to save $5 because of the HBO offer. What we have built it to do, and we haven't actually put the functionality live, is also look at the total cost of ownership of your TV. What that means is that if you buy a Roku, let's say you buy a 4K Roku box, which is a cost of $140, okay? If your cable company charge you $16 a month per box, okay, what's the per month per box? What's the total cost of ownership of that package, including all the hardware? Now, is it cheaper for you to just go off and do a one-off cost of $140, and then we'll divide that over 12 months, for example? So we have that functionality built in. We haven't deployed it yet because it's actually very complex. And again, it was about getting that product out there and live and then working on the roadmap of getting things ready.
So with our final question, will you move back to your slide that has all of the ask on there? Is there any, your slide that has the what can we as a community do to help
yes,
you?
yeah, here.
Is there anything else that you want to add?
So no, I mean, obviously, I'm in a very unique scenario here in that I'm trying to build a business in Missouri, and I'm also trying to build contacts and people I know because I didn't go to any of the big universities locally here, so I do not have a wide portfolio of contacts. So actually, I think one of the key aspects is making sure that if somebody is not familiar to the area and wants to launch a business in Missouri and create jobs here in Missouri, how do we help them get in front of the right people to make that happen? In terms of one of the things I've noted from just going through our sort of seed round of investment is that a lot of this type of business very navigates to the coastal areas, and when we're trying to say no, we want to keep it headquartered here, that's one of the biggest challenges, and a lot of people don't understand why that we would want to do that.
I think that's a great ask, especially for this audience and our panel members today. So thank you so much for your presentation.
Thank you very much.
So before you leave today, I have an ask. Will the 1MC caffeinators please raise your hands? Stand up, maybe even. So these are individuals that are our 1 Million Cups ambassadors that help connect the audience to other audience members, give feedback to our presenters. But I have a special ask of you today. 1 Million Cups is going to be 6 next month, and so we're looking for some ideas to help celebrate and or continue to improve our program. So if you could, please find these individuals today and have a couple conversations so they can provide us feedback. So next week we have Moving House and Trend Desk presenting, so I hope to see you there. Thank you.